In this video, I want to review ventilation technique. When you're giving ventilations, you want to use a barrier device such as a bag valve mask, or also called ambu bag. Throughout this facility, we have bag valve masks on every code cart in the inpatient units. We also have bag valve masks in every AED box located throughout the facility. If someone asks you to grab equipment for an emergency, make sure if you're on the inpatient unit, you grab the code cart with the bag valve mask on it, as well as the AED. If you're in any other location, outpatient or tunnels, anywhere else in the facility that has an AED box, make sure that you grab the AED, the bag valve mask, and if there's Narcan in that box, grab that as well. Just grab everything, just in case it's needed. The bag valve mask has two parts. One is the mask, and one is the bag. The mask itself is a pear-shaped mask. It has a narrow top and a wider bottom. The narrow top is going to go over the nose and rest on the bridge of the nose. The wider bottom is going to come underneath the mouth and rest between the mouth and the chin. There is also a balloon type mask affiliated with this. That's very flexible. We don't want it to be rigid because we want it to conform to the face to make a nice seal. When you put the mask on the face, again, you're going to have the narrow portion rest on the bridge of the nose. The wider portion will come under the mouth, between the mouth and the chin. You're going to press it into the face so that this balloon creates a nice seal. The other portion of the bag valve mask device is the bag itself. Within your bag that's on the code carts or in the AED, you would have some tubing. This tubing can be hooked up to oxygen if you have the ability to hook it up to oxygen. If you do not have the ability to hook it up to oxygen because there isn't an oxygen source nearby, you can just squeeze the bag and there's enough oxygen in the ambient air to give to the patient. The technique to use the bag valve mask, the best technique is the CE technique. So the C is your thumb and your pointer finger. That's going to hold the mask in place. The E is going to come under the chin to do your head tilt chin lift. So for your C technique, there's a little resting place for your thumb on the mask. Put your thumb on there. Your pointer finger will go at the bottom of the mask. You're going to place the mask on the bridge of the nose, covering the mouth and the nose. Put your thumb on that, rest it on that lip. Pointer finger, press the mask into the face, just very squarely onto the face. The E itself will reach under the chin while you keep the mask in place, pressing, keeping pressure. You're going to use those three fingers creating the E, grab under the chin, do a head tilt chin lift. Now you should have a good open airway and a nice seal. When you squeeze the bag, you should see chest rise. When doing compressions and ventilations, so 30 compressions, 2 ventilations, the ventilation should be given over 1 second apiece, taking no more than 10 seconds total to give both ventilations, making sure you have chest rise. If you can't give those ventilations within 10 seconds, you resume compressions for another 30 compressions. Try again. While the compressions are going on, you can be in position, getting ready. After 30, you give 1 breath, 2 breaths, resuming compressions within 10 seconds. If you're having difficulty giving ventilations, let's say you hear air escaping, that means you don't have a good seal. So readjust, make sure you're pressing the seal firmly into the face. If you are meeting a lot of resistance with the bag, I have a lot of people tell me that they can't use these bags because they're too big and their hands are too small. If you have a nice open airway, it shouldn't take much to squeeze this bag, so it shouldn't matter how big or small your hand is. Additionally, we're not going to be squeezing the bag completely. That would give too much air. We want to give it a half squeeze. So even if your hand is small, if you have a nice seal, open the airway, you shouldn't meet any resistance. You should be able to give a nice half squeeze, no matter how big or small your hands are. Let's say that this person has a pulse, but they're not breathing. So maybe they're in respiratory arrest from an opiate overdose. What we would want to do is we want to breathe for them, allowing the heart to do its job. So we're only going to give a breath every 6 seconds. We do not breathe very quickly when we normally breathe, so we do not want to make them breathe very quickly when their heart is still beating. We just want to give the heart time to circulate the blood, picking up that oxygen from the lungs, sending it out to the body. If we breathe too often, we can actually create a lot of pressure inside the chest that will prevent the heart from doing its job effectively. So when we're doing rescue breathing, we put our mask on, press it in, the E, head tilt, chin lift. We're going to give a breath and wait 6 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, breathe. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, breathe. Make sure you look for chest rise each and every time. If you're rescue breathing for someone, you want to be thinking about what caused this situation. So could it be an opiate overdose? Do you need Narcan? So if someone has a pulse, you start breathing for them. You want someone to get Narcan and administer Narcan if you suspect an overdose situation. While you're waiting for the Narcan to either work or while you're waiting for the Narcan to arrive, you'll be doing your rescue breathing. Again, once every 6 seconds. After 2 minutes of rescue breathing, you would want to do a pulse check to make sure they still have a pulse. If they still have a pulse, you'll continue your rescue breathing and you can consider giving another dose of Narcan. It can be given every 2 minutes. If they do not have a pulse, if you've lost the pulse, you would start compressions, ventilations, compressions, ventilations, 30 compressions, 2 ventilations, 30 compressions, 2 ventilations. If you've given a dose of Narcan, you suspect it's an overdose, but you've lost the pulse and you start compressions, you can still give the second dose of Narcan. Sometimes it might take more than 1 dose of Narcan to reverse the effects of the opiate.